It's time now for the Casey Ingram Show on WSTU. The opinions expressed are those of the program host and guest and not necessarily those of WSTU. WSTU does not endorse products that may be mentioned. Any reproduction or retransmission of this broadcast is strictly prohibited without written consent of WSTU. It's time to call in with your questions and comments at 220-9788, 220-WSTU. And now, here's Casey Ingram.
Tired of lines at the boat launch? Sun damage or not using your boat because of the hassle? Call Meridian Marina and Yacht Club because we do all the work so you can enjoy your boating lifestyle. We store your boat inside, launch it with a wash with just 30 minutes notice, and rinse it down before putting it back. We do the work so you can enjoy your boating lifestyle. Call us up at 772-221-8198 or visit us online at meridianmarina.com. I just want to remind everybody you can sign up for a weekly notification of who the special guest will be in the studio at my website, thecaseyingram.show.com. If you're not seeing those emails, check your spam because sometimes they sneak into that spam box. And also, this is a very important topic here in the studio today, but please ask your senator and representative here in Florida to support Florida Senate Bill 204 and House Bill 651. Many nurses are being assigned too many patients to care for, especially in critical care units. Seconds count, and with too many patients, it may be you or your loved one who pays the ultimate price with their life. Let's put patients and nurses above profits. For more information on this critical issue, please visit nursestakeflorida.com. And that, folks, is an easy segue with my guest this evening. This is the lady behind Nurses Take Florida. And this is Julie Griffin. She's a repeat guest, and she is here. I wanted to talk in depth about House Bill 651 and Senate Bill 204 that's in the Florida legislature right now. And just for a moment, I'm going to get on my soapbox. I'm a Republican. I don't believe in adding more regulations to businesses, but this is a different topic. The reason being, this affects hospitals. When you're going down, let's say a loved one's going down the highway, you get in an accident, the ambulance takes you to the nearest hospital. You don't have a choice. The problem here, folks, is you don't know that hospital they take you to. That intensive care unit has 5 patients per nurse or 3 patients per nurse, or maybe a greater number. There are no standards for that. And, this is what we're going to talk about today with Julie. This isn't a free market system. It's a system where the ambulance takes you to where they want to, and it's going to be the closest hospital to your accident. So very important issue. So Julie Griffin, thank you so much for joining us in the studio today.
Thank you for having me back.
Absolutely. You can tell us a little bit about how you're involved with Nurses Take Florida, why you started it, and why these bills are important.
Well, I also wanted to touch on, to further elaborate on what you were saying. I mean, we take so much time and we research so much when we're going to buy a new dress or we're going to get our car repaired, but we don't realize that we need to pay more attention to what's going on in our hospitals. At some time, everyone's going to go into the hospital.
Right.
So if you wait until the last second, you never know what you're going to get. It's rough out there in some hospitals.
And there aren't any signs that say we assign only so many nurses per patient. You walk in blind. I mean, the only way to know is to ask your personal nurse. And there are good hospitals and there are hospitals that are looking to cut cost. And
Right.
as a patient, or maybe our parents are in there, something like that, a loved one, we don't know what those standards are.
Right.
And it's something that just surprises me. When it comes to safety, there's so many things we do regulate, like how many hours a truck driver can drive on the road.
Right.
But yet for hospitals, there is no regulation that ensures
The amount of patients a nurse can have. Also, you were just mentioning that you were a Republican, and I know that there was some legislation or that was signed in. They were trying to ensure transparency for medical bills, and it was appealed. And the main supporter of the appeal came from the hospital systems and the lobbyists that represent hospitals. So if they're hiding those things, you can only imagine what the potential for hiding missed care or errors in the hospital. You just don't know. And the only person, or I shouldn't say the only person, but the most trusted person is the nurse. 18 years in a row, we are trusted more than any other profession.
Julie, if you could tell me real quickly why you took this cause on. You have a personal story to tell here, and you're a senior nurse in your field, or you're a senior in your field, I should say. So
Not senior citizen.
not
but-
senior citizen, but you felt that you had enough work
Yeah.
under your belt that you could speak out, especially for the younger nurses coming up.
Exactly. I've been a nurse for 25 years. I've seen the conditions at the bedside change. I watched as the amount of patients became more and more. The technology that we're using to take care of patients and to save lives it's just miraculous where we've come from then to now, and we're getting more patients on top of that. And nurses that are graduating school nowadays, they get to the bedside and they're overwhelmed and they can't keep up. And that's because you shouldn't have to keep up with that many patients and learn all this technology and be the quick response to save somebody's life. So I was speaking out at work, and it wasn't appreciated, and eventually I was retaliated against, and I was terminated at my workplace. And I was just upset that nobody else could speak out, and they were afraid of losing their jobs. And I took it upon myself to help these nurses, and we created this group, Nurses Take Florida. It's actually off of Nurses Take DC, and there's other advocate groups out there for nurses and patient safety. So that's where it came from.
It's very important. And one thing I want to state, you had mentioned that nurses are afraid to speak out. Folks, at nursestakeflorida.com, there was a petition started to let the legislators in Florida know we need to pass House Bill 654 and Senate Bill 204. I was talking with Julie about this petition, and she said nurses are afraid to sign it. They're going to be afraid their name's out there and they're going to lose their job. And lo and behold, she's right. So folks, I'm asking you tonight, help these nurses out. You don't need to be a nurse to sign this petition, because this could impact every one of us or a loved one, anybody that we know. We won't know until we're in that situation and be admitted to a hospital. So let's, take this issue on before it becomes a problem for you personally. And we need to support our nurses here in the state as well as nationally. It's a critical issue, I feel. And certainly, when you go to a hospital, you want to leave it alive. And it depends on the nurses to help.
Talking about the retaliation, it's also part of those bills that you mentioned, Senate Bill 204 and House Bill 651, because right now there is no one that a nurse can speak up to. There is not that higher authority that can come in and actually look at what's going on. So if the nurse cannot report it to somebody, she's stuck with it and she carries it home, and it drives those nurses away from the bedside care because they're internalizing all of this, and it's a hard thing to carry on your heart. You watch patients that sometimes suffer an injury or whatever the case may be due to poor staffing, and we can't speak out for it. I've had numerous patient groups reach out to me and ask me, please share your story, because a lot of residents, they just don't know. They think that the nurse is able to advocate for, and we should. That's our code of ethics. We should be able to advocate. But when you're looking as a nurse, well, I have a family to take care of.
That's right.
That's going to be the most important thing to you at the time. It's only when you get later on in life, when you see the whole totality of what's going on, where you're able to raise your hand and say, hey, wait a minute, that could be my mom or that could be my father. I don't want that to
happen to anybody. You're trying to create a safe staffing level. And House Bill 651, Senate Bill 204, its delivery of nursing services requires healthcare facilities to implement staffing plans that provide minimum direct care registered nursing or nurse staffing levels, prohibits healthcare facility from assigning unlicensed personnel to perform functions or tasks that should be performed by a licensed or registered nurse, requires AHCA to post on its website information regarding healthcare facilities on which civil penalties have been imposed. You can learn more if you just go to the Florida House or Florida Senate and Google in those bills, HB 651, SB 204, but that's the bill in short summary. So, I'd like to hear from somebody who would disagree with that bill.
Right.
It's common sense.
You would think that everybody would support this bill. Why is it not being supported? And I just think it's because the public doesn't know. The public doesn't know that there are things going on behind those doors. When they think about the hospital, they think about that as a trusted facility to take care of their loved one. And I'm not saying every hospital does this, because I right now work for a very good hospital where I would go. I would trust the care at that hospital. But there's a large majority of hospitals out there that they have a bottom line and they have shareholders, and they have to tell these shareholders, well, next year we're going to raise the profits by XYZ. And they can cut these costs everywhere, like whatever, they can cut the costs. But the one thing that they shouldn't cut is the nursing care.
Absolutely. With these bills too, it's important that you speak out again to your representatives and your senators. Both of these bills are stalled.
Both of them.
They're not even out of committee.
Always.
And even these have been introduced in the past, and the same thing. They're stalled. They're kind of buried. So, these bills are incredibly important. We really wanted to bring this issue to light. And Julie is an RN. You've seen so many different stories. And since I've met Julie, there's been other stories, and I follow their page, Nurses Take Florida, Nurses Take DC. And this is just a common theme across the country, with the exception of, I think there's one state that has passed some regulations, California of all places.
And that was so many years ago. And the studies show that the care is better, that the outcomes are better, and that people didn't lose their jobs. It's just this bunch of wordsmithing going on by the hospital executives and by lobbyists. Oh, we're going to have to close down, or, oh, people are going to get laid off. It's not true. Studies show that the outcomes are much better, which in return, guess what? It lowers prices, because you're not coming back to the hospital in the next week, in the next 2 weeks. It just makes sense.
It does make sense. California has imposed some regulations, as well as the country of Australia.
Right.
And that's where you're getting a lot of your statistics that, no, this really does work. Costs are not going to rise.
Maybe in the beginning, let's not, I don't want to just
overgeneralize.
I don't want to be like some of the hospital executives and say it's not, because in the beginning, there may be some rising costs because you have to incur additional staff. But at the end, not only are you saving money, you're saving people's lives. That's what it boils down to.
Which is paramount importance.
Right. You can't put a dollar amount on somebody's life. You just can't.
You certainly can't. Let's talk about another issue that comes up a lot, and they say that there's a nursing shortage. Is that true?
No, absolutely not. There may have been a nursing shortage maybe 20 years ago, but if you look at the numbers provided by the government and the studies done, actually Florida, there may be, I think, maybe 4 states that are facing a shortage, but Florida is one with the surplus of nurses.
Really, a surplus?
A surplus of nurses, and it's predicted to be bigger by 2030. And I have a lot of these people saying, oh, well, there's a nursing shortage. No, there's a shortage of nurses that are willing to work in this environment. These nurses, they go through school, they get out. We have plenty of new graduates in Florida. They get the job. They're there for their 2 years. They get their education or their experience, and then they get on an airplane and they fly to California and work 3 days a week and fly right back to live in Florida.
Say that again. They fly?
I actually did a contract out in California, and I met many Floridians working at the hospital out in California. And I was talking to them, and they would plan their days so they would work Thursday, Friday, Saturday, and the next Sunday, Monday, Tuesday, which would be their 72 hours in a 2-week period. And then they'd fly back and live in Florida. Because they liked Florida better for low taxes. There's no state income, but to do their job, they got on a plane and flew to California. Not only did they make more money, they had a safer environment that they worked in.
That's an incredible story to be told, because we certainly don't want our workforce leaving for another state because of a better work environment. We should have that here. And honestly, this should be a regulation all over the United States, but we got to start here right at home. This is where we are. Always start locally and see if we can change
Right.
what's right.
There
for
actually
us.
are 2 federal bills up there right now, and we're
Good to know.
we're going to Washington, D.C., Nurses Take D.C. on April 21st and 22nd, and we're going to be rallying there, and we're going to have a lot of good classes that can teach nurses how to interact with your representatives, because a lot of people are intimidated just because they have a title behind their name, but guess what? We do too.
That's right. That's right.
So we can. I mean, we're right there at the bedside. We know what's happening. We are the ones that need to tell these representatives what's happening. Because if we don't talk to them, the only people they're hearing from are the hospital lobbyists.
So Nurses Take DC, April 22nd through the
21st and 22nd.
21st and 22nd in Washington, D.C. It's a rally.
And we're doing a conference.
And a conference where you're going to help nurses learn how to approach their representatives to hopefully affect change. How do they find out more information? Do they go to Nurses Take Florida?
They can go to nursestakeflorida.com. And for Nurses Take DC, it's nursestakedc.com.
Okay. More information there. So
and
again,
Facebook.
Of course,
Everybody's on Facebook.
Everybody is. Julie, let's talk a little bit about another bill that was recently introduced here in the Florida legislature, and that's House Bill 607, which would remove unnecessary administrative burdens for physician assistants and nurse practitioners to make it easier for patients to access the care they need, where and when they need it. It was introduced by Representative Pigman.
Right. So this actually is, in my view, a very good bill. We have nurse practitioners that are highly educated, trained to provide care for patients, routine checkups, or let's say you can't get in to see your doctor. You know, he has a nurse practitioner that you can see. Let's say you have to go every 3 months to get a checkup for your lab work or whatever the case may be. They always have the ability to refer up to a specialist if they can't figure out what's going on. I'm kind of conflicted with this because a lot of nurses at the bedside, they see how hard the job is at the bedside and they see the ability to become a nurse practitioner. So a lot of our young nurses are leaving the bedside to become a nurse practitioner. But I think it's great because they're educated to provide that care.
Right.
And in some instances, you could live an hour away from a hospital. And so what are you going to get? You're going to get a highly trained nurse practitioner that can treat those things that don't require emergency care.
So there are some good aspects of it, but like you said, it also means that good nurses are leaving the field for bedside nursing. Tell us a little bit about the day in the life of a nurse. We talk about, okay, why is it important, Julie, that maybe we should only have, and I'm throwing the statistic out here, I don't know what number there should be, but I'm saying, why is it important to have 3 patients per nurse in ICU? Why can't you have 5?
Well, you should only have 2.
Okay. See, good thing you don't follow my statistics.
But and that's the standard of care, 2 patients per nurse. Sometimes it can be 1. They're so critical. Actually, I've even seen 2 nurses for 1 patient. In the intensive care setting, you could be on devices that require taking all of your blood out of your body and putting it back in. So you want to be right there and know what's going on. If you have 3 patients, 4 patients, whatever the case may be, I may be assisting someone else and there be a turn of events and not be able to be right at that critical patient when they need it.
So it's absolutely important. This is why the number of nurses per patient is such a critical issue. There's a lot of issues, of course, in healthcare that you have to deal with as nurses. Another one is the long hours that you work.
Long hours. Some nurses actually like the 12-hour shifts. I guess it depends on what your situation is at home. I find the 12 hours better because it gives me a longer period of time to get to know my patient. I come from the day when we did do 8-hour shifts. And when you have a half an hour of just getting report and then say another hour of going through the chart, you're already looking at 2 hours off of your day. And so it's not really that intimate.
Right.
Like it should be.
Right. What can you tell people that are admitted to the hospital or their loved ones? What kind of questions should they ask? What can they look out for to know if this is a hospital that staffs adequately or not? And what do people do if you're in a locality where you can't travel a long ways for another hospital?
Right.
What choices do patients have?
Well, at the bedside, if you watch the nurse. And I'm not saying there are a few nurses that maybe give us a bad name. I totally admit to that. Once in a while, you'll see it on the news. Such and such nurse was accused of. But the majority of nurses, they want to do the right thing and they want to care for you. And their heart is in it. So a good outcome for you is actually a good outcome for them. So watch the nurse. If they're running around and they can't catch up or the phones are ringing or the call lights are going on and you don't see any nurse in the hallway, that should give you a clue that, hey, they're struggling here.
There's a lot of hustle and bustle in there. They can't keep up. And it's certainly a warning sign. But again, it doesn't really help. Again, and this is why the regulation is needed. It doesn't help the person that's already admitted in the hospital, maybe can't be transferred somewhere else immediately.
Right.
Maybe they don't have a patient advocate looking out for them. So,
and in Florida, I've seen many elderly people, their families still live up north and the elderly come down here. It's great weather. Like I said, lower taxes, cost of living may be a little bit better. So we have a very high population of the elderly that are sometimes alone, which makes them vulnerable. And if they don't have an advocate, the nurse is the advocate. And that's who we're out there trying to speak up for, those that don't have a voice. Because I promise you, the minute someone's in trouble, they're not going to come out and say, hey, where's the CEO? Give me the CEO. Right. They're going to scream, nurse, I need your help.
That's absolutely right. For the listeners, why do you suppose these bills are not advancing and they haven't in the past? What's the roadblock?
I think it's money. I think the hospital associations have lots of money, and that just goes to show you if they're willing to spend those millions, because it has happened, they spend millions to block this legislation. So how many more millions are they saving? I mean, it's just, and I'm a for-profit kind of person. I don't have any problem with free enterprise. Right. I love America, but you have to draw the line somewhere. Can you imagine if we didn't unravel the whole tobacco industry?
Right.
All that was hidden, lives were lost.
Right.
Secrets were uncovered, just like the opiate crisis. It's the same thing with healthcare. There's secrets out there. There's a reason they don't want you to know what's behind.
That's right. It's when you're putting profits over lives, that's when it really needs to be looked into. And that's what our elected officials are here to do. Sometimes regulations are needed, and this is one of those cases. So nursestakeflorida.com, you can find out all kinds of information there. You can find out more about the bills. But folks, please sign our petition. And the best thing you can do is write your legislator, your senator, your representative in your district. Let them know to support this bill, and let's try and get this thing out on the floor for a vote this year.
And if it doesn't happen this year, we're going to follow who's going to be running for office. Yeah.
Julie Griffin, Nurses Take Florida. Next week, we're going to have attorney Robert Lewis in. So if you have some legal questions, call in with him. He might be able to help you out. Thank you, Julie Griffin.
You're so welcome. Thank you.